Okay, we had you click on our website, and here's the orthotic section. To start with, on an orthotic, it doesn't do any good unless you have a good pair of shoes. So a couple of things I want to show you really quick about a shoe. It should have a good heel cup support. So what it is, there's a hard, firm surface on a shoe that's going to support your heel. The other things, the forefoot needs support. And there's a lot of shoes that the material is too soft and you have no support at all. Here they even put a couple extra pieces of material that tie it back into the sole of the foot. So once you lace the shoe up, it gives you a pretty decent support. The other thing is that you want to be able to get the little inserts that they put in out before you put your orthotic in. A lot of them use the sidewall of the shoe to build it up thinking you got an arch. And if you leave it in, what happens is the new orthotic you're putting in is going to come at such a severe angle, it's not going to be worth anything to you. We're looking here also, the shoe is a semi-flexible. It has a little air cushion, which is good for somebody that's on their feet a lot. The thing lately that has come about is the new shoes have been coming out with almost like a ducktail. That the shoe extends so far beyond where actually your foot is in. So if you would look straight up and down at the shoe, the distance between the shoe and where your foot sits in there, the greater that is, the more it's off on your ankle, so you don't have a biologic type of ankle to where it's actually moving at the joint where it should be. So some of these that are built out will actually be this far out from your foot itself. So you're looking for a shoe that's straight up and down in the back, as close as to you can, a good firm heel support, and a good firm lace support that ties into the sole of the foot. Okay, we're looking at the orthotics we're going to make. These are sport orthotics. They're made actually for running on, so they're extra a little bit soft. They'll last a good year running. They'll last about 2 years if you're just going to be walking in them. These are made to where they expand. So these are not an orthotic that we have to cast, which we used to do before, or where you stick their foot in a block of foam and send that off and have somebody else make them. The reliability of some other people making them, the time factor that occurs, is just not warranted. We can make these here, and actually you walk out with a pair that's fitted to you. Okay, so I'm going to go ahead and get these started. They come sealed up, and we order them at the time you come in because they have a shelf life because of the fact that there's expandable gel inside that needs to be kept within a period of a year. And there's so many different sizes for everybody these days. You know, they start down to a very small size. They even go down to size 3, but they do go up to size 13. And this is men and women's are also. They're cut for your shoe. Okay, taking these out, just want to make sure that they come close to fitting the foot to start with before I do any of the cutting. Up, back, okay, so we got plenty of room. They're in the back, they're wide enough. Now I'm just going to make sure that they fit into the shoe. Raise this one up. And the ones we took out, I'll have to cut and measure in. So very little trimming is needed. Let's see if the width's going to make it in the shoes. The orthotics are used not only because of foot pain, they're a preventive type of support for ankles, also knee, and for pelvic or SI joint problems. Okay, just slide your foot into this and see if it's going to fit okay. Put your back in. Okay, you got enough room. Okay, you can take it off. So let me just cut the other one in. the shoes need to be left on for the rest of the day. The reason being that 90% of the expansion after we put the warm water in here and it raises up will happen within the 8 minutes that we're holding the foot in the right position. But it will raise another 10% throughout the day, so we need these in your shoe with your shoe on. You don't have to be up walking for the rest of the day, but at least that the shoe is on so it molds the rest into your arch. Okay, now we got these cut out right. Okay. Now the reason we're actually making her some orthotics, go ahead and slide your feet forward here a little bit and let them relax. There's a slight pronation, meaning that the foot is rolled in some. And what happens in later life, the toes start to separate. This is called the first ray between the big toe and the next one, and you start getting a space in through here. When a space occurs here, this bone, the metatarsal head on this side, is moving out. And what occurs is that the big toe then moves in, forming a bunion. So this is pre-bunion type of fitting that we're doing right now. You also can have a bunion on the little toe side. Is not as common, but it also occurs. So helping to prevent bunions or stopping the progression of bunions is what an orthotic is used for. It's used to actually support the arch. Plantar fasciitis is a big thing that now, a lot of people know what's going on with that because you hear it a lot. But it's actually the arch being strained. It can be from a bone spur that's occurring. It can become from heavy pushing, people that push heavy weights. It could be somebody that's just been on their feet for a long time, or poor shoes without any arch supports, that your arch is stressed. So having these orthotics in supports your arch up and puts it back to a normal position. The other thing that happens is we see a lot of young women that have severe ankle sprains. And ankle sprains are because the instability of the way they're hitting a lot. So putting orthotics in supports the ankle as well. And because of this foot turning in, that puts stress on the inside of the knee, so we get some knee pain. Patients come in that need the orthotics, as well as an SI joint that locks up and they can't keep it unlocked because of this turning in on every step that they're doing. Okay, we're going ahead and start making the orthotics now. It tells us that we need 4.5 cc's of water. Now, the reason that they're doing this is we're going to stick the warm water inside, and this will start expanding the gel in. We're going to hold the foot in a neutral position so it'll build up to the foot in the position where the correct position the foot should be in. So, I measure here a little bit of fluid. And the amount of fluid is a little bit more than what's required, so some will be running out from here, so it's not that it's leaking. Okay. We pre-pinhole the top in a couple of places just to let the air out as it's expanding. Now we're going to have you raise your foot up and put it back down, and you want to look straight ahead. Okay, now you can see the foot is turned in. I'm going to bring it to where it's even and hold it in that position. Okay, look straight ahead. Don't look down. People looking down while you're doing this will have a tendency to put too much weight on the forefoot. We want the weight pretty well evenly distributed, and that's why I even have the other one underneath right now. And you want to time, you got your watch on, go ahead and time 2 minutes for me. Okay, we've just come back from a little intermission where I finished making the left orthotic. We're going to go ahead now. I'm going to show you the difference. There's this pronation that's the foot's turned in a whole lot more even than this one. She noted to me that she had an injury at one time on this whole side, and it still affects her. So a lot more pronation on one than the other. And because of having these done individually like it is, and not that something's just taken off the shelf, they're made a little bit different. So this one is filled up more when we put it underneath to make them both that the ankles are in alignment. So let's stand up. Okay, let's bring it out just a little bit. There we go. Now this one. Okay. And now this one's perfect. This one we may want to put a little bit of a wedge just to go out a little bit farther. You can only put so much on the inside on the build-up, and then you modify it from the outside. So perfect on this side. This side, there are even a 3-degree little wedge that by putting it underneath the heel will bring it over just that little bit more that's needed. So these orthotics we're going to have her use now for 3 days because walking with your foot in this pronating position for years, and now all of a sudden now leveling it out, it's going to feel like you're walking in this position on the sides of your feet, even though you're walking flat now. So the body will accommodate to that if they start learning this and you wear it for about 3 days. Then we'll come back and we'll make any final adjustments, even if we have to put a little 3-degree wedge in the bottom of this one. Okay? So this kind of takes care of what the orthotics are. We'll put them in the shoes, walk out with them right now, and they're a done deal. And usually they feel great right from the beginning. It's not like, well, you got to get used to them and they hurt here or hurt there. So this is something that is done by the time you walk out. Okay? Now, the other things that we have, there's different types of orthotics. Let's go ahead and take these out. We also sell and form the diabetic shoes. The diabetic shoe these days do not look like a diabetic shoe of old. They're lightweight. They're made for people with diabetes, of course, that have even peripheral neuropathy, which 50% of all diabetics have. The shoe itself is extra light for the weakness that people start to occur in their later years with diabetes. So light shoe, they're made from a material that is more anti-friction. So you get less blisters than a normal shoe with these because of the material that they use. The foot in the front has a wider box and also a deeper box, because a lot of people will have with the diabetes that they'll have toes, that the hammer toes that are short, and they start buckling under and the knuckles actually come up, so they make them a little bit thicker. They're wider for the starting of the bunions that people will occur. And the lightness again for neuropathy. So they actually make shoes just for diabetes. And along with that, they make orthotics. Now somebody that has diabetes, and it's usually in the older group that we're looking at, the type 2, also their foot has been in a severe pronated position for many years. And what happens is you can't change this back because the bones already have changed in this position and the shortenings of the ligaments are severe. So you do an accommodating type of orthotic. Not that we want to put her back in neutral. What we'd want to do is actually just support up to where she is. So she has an accommodating arch support, so hopefully not letting it get worse and yet causing no discomfort from trying to push up too hard on the arch. These are also made out of a material that give a lot of extra cushion. Again, for the diabetes. A lot of them can't feel their feet, so it's real easy to start having problems because of roughness, picking up pebbles and things like that. And the softness of this helps to go ahead and prevent a lot of the problems they have, as well as feeling a lot more comfortable. The shoes come with, there's 3 different pairs that are made with the shoe itself. They come in different sizes, of course. And they can be cut down just like the other ones were. But the three pairs are, the reason is about 4 months these start to wear. They're made of such a soft material that they start wearing down, and you go ahead and put the new orthotics in of these. So every 4 months you're getting a new set of orthotics that come with these. And we make them all at once when you come in. So you're making all 3 sets at one time. And they're a lot faster because all you're doing is just holding them up on the arch side and supporting the foot down in it. So accommodating orthotics are a little different than the ones we just made. And the other thing that we have here, we have a lot of different supplies that go along even with the diabetic shoes or diabetic socks. The idea behind the socks are that they are more comfortable because they have a heavy, dense material on the bottom, again like the cushioning the foot a little bit more. They're going over the heel and over the ball of the foot where a lot of the pressure is at. They also have, it's tapered. There's a slight tightness more in the foot, and it loosens up as you're going up the foot. So the elastic is a lot larger. There's a lot wider area of elastic, so it doesn't cut in when you pull your sock up. So you don't have that indentation. The other things that you can put in the shoes, you have heel cups. Somebody that has a bone spur on the heel. These are extremely soft, and also the inside here can be taken out to make almost like a little divot in them, so the pressure of the bone spur is not hitting on anything. Other little things, once somebody has a severe bunion, they can actually try to compensate it as a night resting splint that will hold the big toe over, put less pressure later on the outside of the bunion itself. These are more just night splints. It's not made for walking in at all. And then there's metatarsal head. Women that have wore high heels for many years, coming down on the ball of their foot, the area on the bottom, just hold on to yourself. On the bottom, in here, the metatarsal heads, because of all that pressure, the bone starts to stick down. So, very, very tender. By putting a pad and lifting up in that area, that normally flattens out the toes so the hammer toes are less, it also supports that bone up so the pain's gone. And that can be put in any of the orthotics as well, or just separately by themselves. One last thing that we have is the gels. A lot of times people have worn shoes that are way too narrow because better shoes as far as looks go. These are made out of a material that are non-friction. They separate in between the toes, and you can wear them actually when you're walking or just use them as a night splint. So there's many little things that can be done for the foot for comfort, as well as for stopping a progression of a problem like bunions or hammer toes, or just a curling of toes. So we've covered the different type of orthotics and some of the supplies that we carry here that you can come in and just pick up. Thank you for your time.